Hi, my name is Laura Santoro, and today I'm going to give you more information on heat and cold therapy. This is used at home and it's also used in the medical field. This might be one of the oldest remedies we know is heat and cold therapy or just applying ice to something. With the heat and cold therapy, it's most important to know when to use it, how to use it, and what to avoid when you're using them. For cold therapy, this reduces inflammation by decreasing the blood flow. It and while the heat promotes blood flow, those are two completely different things, and you want to make sure you're getting the right treatment for the right injury. For the cold therapy, it has to be used within 48 hours of the injury, and anything after that, usually heat is recommended, or anything chronic heat is recommended. You can always alternate the heat and cold therapy for some exercise induced muscle pain. At my previous job in the hospital for cold therapy, we used to fill up ice in plastic bags and put them in a pillowcase and give them to patients. The pillowcase helps with the barrier between the ice and the skin, and you have the cold ice, which is enough to penetrate through the skin, so it's a good balance. For more information about cold, um, when you use it, you would want to have something like osteoarthritis, a recent injury within 48 hours, any gout, any muscle strains, tendinitis, or even migraines. This can be helpful. For migraines, some people put cool cloths behind the back of their neck. That has been known to help some people. And the cold therapy has to be applied within 48 hours because it slows the blood flow to there, which would be slowing the rate of the inflammation. If you apply it after the 48 hours, the inflammation has already set in, and then you're just freezing the blood in there and it's not able to move as much as it should be to help move the inflammation out. A lot of sports injuries are common to use cold therapy with. There is an acronym called RICE, and it stands for rest, ice, compression, and elevation. Any kind of sports injury, any muscle or knee damage, ankles, you want to rest the area. You want to put ice on it with a barrier, of course. You want to compress it so you can help the swelling not to expand too much. And then you want to elevate the extremity so it helps drain some of the fluid out and all that swelling doesn't stay in one spot. Some types of cold therapies you could use is an ice pack. It's always important to have a barrier. Something like this is a cold ice pack. It is plastic on the outside, but that is not enough for a barrier. So I'd recommend putting a sheet around it, a piece of cloth, or even a paper towel, because if you get any ice burn on your skin, that will make the injury a lot worse, and that can also very damage your skin. Soaking any extremity in cold water helps. Any baths. Some people have been known to take ice baths. As long as it's not too cold of a temperature, then that can help your muscles. Cold compresses or packs, like this green one, those help. You could put a pack like this one in the freezer, and it gets cold, so you can put it on. This would be something good to put on the back of your neck for a migraine. And then if you don't have any cold packs, you can always just use a frozen bag of vegetables. That is very common to use. Most importantly, with any cold therapy, you don't want to put it directly on your skin. As I said, that can cause the skin burn. For heat, heat dilates the blood vessels, which helps the blood flow go through them. This helps when your muscles are sore after you work out. You have lactic acid build up in your muscles, and increasing the blood flow will help filter out that lactic acid faster. It helps with improving the whole circulation of your body, so that helps with the muscle pain, any after swelling, things like that. This is most commonly used for chronic pain, a lot of muscle pain or arthritis even. And there's a lot of types of heat. This same pad can be heated up and stuck in a microwave, and then you can put it on the site that is warm. And this is already a soft cloth, so you don't have to worry about it burning your skin. A lot of people use hot water bottles. You can use a heating pad. That was a hot compress I showed you. You could take a hot bath. A lot of times you can heat up a hot bath, put in some Epsom salts in there. That has been known to help. You could try a paraffin wax treatment. There's rubs. Everybody's always heard of the icy hot patches. Or there's many different kinds of over-the-counter patches that are good for your skin that won't damage it. With heat therapy, there is dry and moist heat. This would be a dry heat, and also A heating pad like this one would be dry heat. And as you can see on here, this has the cloth around it so it doesn't burn your skin. And in there is where all the wires are. And something like this, they do have settings on there, but you want to make sure it's not too hot for your skin. And you also don't want to leave it on for an extended period of time. And then these are also electric, so you want to make sure you don't leave them in plugged in overnight or without anybody using them. Or you don't want to get them wet too, that's very important. For some moist heat, the hot water bottles will help. Filling up any hot towels, you can squeeze them out and then put them in a plastic bag for moist heat. That helps a lot of muscle pain. A lot of times with muscle pain, cold therapy might feel better, it might numb it, but it's not enough to get through the deeper part of the muscles, which is usually what's hurting you. So moist heat would be reserved for any right before any activity that helps with stimulating the blood flow through the muscles. So if you're going to go run or work out and you have a sore spot, then the moist heat would be best to use that. You never want to use a lot of heat. Don't leave electric pads plugged in. If a wound is open for hot or cold therapy, you never want to use it. So it is important to know what you're going to use and when to use it and to be safe using it. I've showed you the ice pack, the heating pad, the other hot compress, and this is one other cold compress. They're jelly. You can freeze them, but they're not too cold on your skin, but you still want to use a barrier. So those are some examples of the heat and cold therapy. And then now you have a little more ideas of when to use it. Thank you.